Good afternoon.
Hello.
Hi, my name is Evelyn. I'm a nurse. I'm also an MSN student at the University of Texas at El Paso. And today I will be doing a head-to-toe assessment on you, okay? In this assessment, I will be required to touch your hair or your other body parts. We will skip the breast and the genitals, okay? Sometimes I'll require to hit on you or use a little pen light. Is that okay with you?
Yes.
At this point, can you tell me your name and your birthday?
Denise Wharton, 22263.
All right, Miss Denise, which name would you like me to address you with?
Denise, please.
All right, so Denise, I will check your vitals and then I'll go over and wash my hands, okay? This will include your temperature, your pulse, your respiratory rate, your blood pressure, and please tell me if you're in pain or discomfort along the way, okay? All right, Miss Denise, let's get started.
Okay.
We're going to test your first cranial nerve. This will be the facial. It's the 7th in the order.
Okay.
Can you raise your eyebrows to wrinkle your forehead? Very good. All right, can you puff your cheeks for me? Smile, and then frown. Is that uncomfortable?
No.
Great, you did great. Okay, are there any changes with your vision?
Recently I saw my eye doctor,
Okay.
and just a little bit, but they're corrected with glasses.
All right, that is very good. So your other nerve, the optic nerve, the second one, is taken care of because your vision is corrected. If that was not the case, then we would have had to test you using the Yagat cards or the Snellen's chart, okay? All right, so then now I will look into your eyes. I will shine a light, okay? I'll see how your pupils react. Is that okay?
Yes.
Okay, so look straight in my light. Good. And your pupil constricts, and I'll check the other one. Great. They both constrict and they are equal, all right? So now I want you to focus on a spot on the wall, okay? I'm gonna move a pen. When I bring it close to you, I want you to look at the pen, move your eyes only and not your head.
Okay.
Just follow the pen with your eyes. Ready? Okay, here we go. Focus on the pen and up, down, back up, and across. All right, I'm gonna bring the pen close, focus on the pen, and good. Your eyes are looking at the pen and looking towards your nose, and that is accommodation. Very good. Miss Denise, have you had any trouble smelling lately?
No.
All right. Looking at you, I can tell that your nose is well aligned, symmetrical. I will look into it and make sure we don't have any nodes or lesions. Alrighty, and the other side, great. Can you close one ear and then blow in and out? And then the other one? Great. Next, we're going to check your mouth. Okay, we already did one test. You smiled, there was no droop. That is great. Do you have all your teeth? Anything changed with that?
No.
All right. Any trouble swallowing?
No.
Okay. So I'm just gonna look in. I will use a tongue depressor to look at the sides and then depress your tongue so I can see farther. Okay. And I still have my light. You ready? Mm-hmm. Okay. Let's do it. Okay. No lesions, swelling, anything. All right, so I'm gonna depress your tongue and we're going to test another nerve. Okay. Move your tongue to the sides and then the other side, alrighty. And then raise it up to the upper palate. And I'll check here and I don't see any swelling. Let's check the strength of your tongue. All right, I'm gonna initiate a gag reflex. Good. That is a positive gag reflex, and it tells me that your nerve number 10, the vagus nerve, is great, okay? I'm also going to palpate, so I perform hand hygiene, and then I don my gloves. And we're checking for lesions. Okay. All right. Great. Can you stick your tongue out and say ah?
Ah.
Good. Your uvula is midline. All right. So when I did your assessment there, your uvula and your soft palate are moving together, and that is a perfect sign of your positive glossopharyngeal. Okay. The other thing that I saw, there is no swelling on your tonsils, so that is the expected outcome.
Okay.
Okay. Has there been a change in your ears recently? Are you still able to hear correctly?
Yes.
Okay. All right. So next time we'll look at your ears. Okay. And with you saying that you've been hearing okay, I'm just gonna test it, make sure you can. I will whisper something and I'll have you repeat it to me. Okay? All right. I'll include this one. Apples and bananas.
Apples and bananas.
Good.
2017.
Great. That tells me that your vestibular cochlear nerve, which is the 8th cranial nerve, is working okay. All right. So next I will look into your ears. Okay. Any pain when I move your auricle?
No.
Okay. How about when I wiggle this part?
No.
All right. Okay, and then we'll repeat the same here. Any pain when I move your auricle?
No.
How about that part?
No.
Alrighty. Great. Everything looks great.
Good.
Well, I'm still testing your ears. We'll see to make sure that you can hear equally on both ears, okay? This test is called the Weber. Can you hear that?
Yes.
Is it equal?
Yes.
Great. So my next test will check if you hear better with your bone conduction or with the air conduction, all right? Tell me when you can't hear it anymore.
I can't hear it.
Okay, how about now?
I can hear it.
Tell me when it stops.
It stopped.
Alrighty, let's do it on the other side. Can you hear that?
Yes.
Tell me when it stops.
Okay. It stopped.
How about now? Tell me when it stops.
Okay. It stopped.
Good. You will notice that your air conduction is longer than the bone conduction, and that is the positive outcome. Okay. Okay, so I'm going to continue assessment on your face. I'm gonna glove up because I will go to the hair next, okay?
Okay.
Alrighty. So, can you clench your teeth for me? Okay, and I'm gonna check your muscles right there. Good. Any pain?
No.
Okay, open and close. I'm checking your TMJ, temporomandibular joint, right there. Alrighty. Okay, and then can you move your tongue, push your tongue against your cheek? Alrighty, and then the other side. Great. Okay, so the next thing I'm gonna do, I will check your sinuses. All right, these are your maxillary sinuses. Any pain?
No.
Good. How about there?
No.
All right. Now, I want to see if you can feel sharp and soft touching, okay? All right. I will do that together. Okay, so close your eyes for me. All right, do you feel that?
Mm-hmm.
How about that?
Yes.
Are they the same?
Yes.
Okay. And do you feel that?
Mm-hmm.
How about that?
Mm-hmm.
Great.
Yes.
Okay. All right. So next I'm gonna look in your head, okay?
Mm-hmm.
And I'm looking for lesions, the color, and your hair, any swellings, any pain there?
No.
All right. How about right there?
No.
Okay. Okay. Can you move your neck up and down for me?
Like that?
Yes.
Okay.
Good. And then chin to the shoulder. Good. And then the other side. Good. Any pain or discomfort? Already. So finally on your face, I'm gonna check your lymph nodes, okay? Start right there. Any pain there?
Mm-mm.
Okay, how about there? How about the back of your ears?
No.
And here?
No pain.
How about there?
No.
How about there? Okay, and then right there.
No pain.
Good. There.
No pain.
And here. Good. So I checked your face. Your nodules are not swollen. Your lymph nodes feel good. There are no lesions or changes in color.
Okay.
Okay. Miss Denise,
Yes.
I'm going to check the strength of your muscles. Okay. So I'm going to have you turn your head to your left.
Okay.
And I'll have you push against my hand so that you turn to the right.
Okay.
Okay. Here we go. Push. Great. How about the other side? Okay. Push. Good. Now I want you to shrug your shoulders against my resistance. You ready?
Yes.
Okay. Good. Nice and strong. Next, I'm going to assess your back. I do not see any lesions, any sweating. I do not see any misplaced hair or nodules, okay? So next I will feel to see if there's any lesion. Good, and I don't feel any. Good. Any pain?
No.
Okay. All right, so I'm gonna listen to these sounds, okay?
Okay.
Okay, next I'm gonna have you take a deep breath and then you'll hold on inhalation, okay?
Okay.
And I'll feel for sounds right down here. You ready? Take a deep breath and hold. Okay, hold right there. You can breathe out. Good. Okay, so now I'm gonna have you take a deep breath, exhale, and hold. Okay, and you can breathe. And I'm just going to check. Good. That's 2 centimeters. That tells me that your diaphragmatic excursion is 2 centimeters, which is normal. The normal range is 3 to 5.
Okay.
Alrighty? Okay, so next I will check your thoracic expansion. Take a deep breath. Good. And out. Good. Another one. And out. Good. So in that test, my thumbs will move as your lungs expand, and they moved in a symmetrical manner, which is normal. Okay. All right. So now I'm gonna have you repeat after me. Okay. As you breathe normally. Okay.
Okay.
All right. Say 99.
99.
99.
99.
99.
99.
Good. And that tells me that there is no frenulus present. Okay. That is good.
Okay.
So next, I will have you take deep breaths and I will listen to your lung sounds from the back, and then we'll continue at the front. Okay? Take a deep breath and out. Great. And out. Good. Another one. And out. Another one. Good. One more. Out. More. And out. And out. And good. Alrighty. So let me listen to your lung sounds from the front, okay? Put this down a little bit. Okay, take a deep breath. And out. Good. In. And out. And out. Good. You're okay. And out. Good. And then now I'm going to have you raise your hands above your head. And I will listen here. Take a deep breath. And out. And then this side. In. And out. Good. So your lung sounds sound good. You can rest your arms. And I was looking at the distance from the front and the back. It's called the anteroposterior diameter, and it looks good. Okay? So everything sounds good and looks good in your lungs. Next, I'm gonna drape you so that we can do your heart, okay? Okay, then I'm gonna raise your gown.
Okay. Do you want to go on the camera?
Here. I'm gonna have you lean forward a little bit. Okay. Okay, all right, and then we'll lay down. Miss Denise, next we're going to inspect your heart, okay, and then I will palpate, and then I will listen, okay, all right. So I do not see any obvious pulsation, all right. Usually at the mid-clavicular spot down the line on your fifth intercostal place, this right here is where we feel the point of maximal impulse, which I can feel your heart beating. All right, I don't feel any masses. I'm gonna listen, and I will start with the top right sternal border, listening for any breweries. And then the left, and then I will listen here. That's your Erb's point. Good. And then I will repeat the same with the bell. Good. I do not hear any breweries or any thrills. I do not hear any murmurs either.
Oh, good.
Next, Miss Denise, we're going to look at your belly, okay? You will notice a slight change in the order that I'm going to do it. I will first look or inspect, and then I will auscultate. I will listen. Usually that is the last part to do, but in the abdomen, we don't want to start touching and percussing, and then we will activate your bowels, okay? Alrighty. So I do not see any lesions, any change of color, no sweaty, clammy skin, okay? Now let's listen. And I'm going to listen with the diaphragm. Start with the right lower quadrant.
Okay.
Good. And then the right upper. Good. Left upper. And then your left lower. Good. And your bowels are moving just fine. When was your last bowel movement?
Yesterday.
Good. And then I'm gonna slightly palpate, just slightly. Any discomfort?
No.
Okay. Alrighty. Good. I do not feel any masses or lesions, okay? So now I'm gonna do the same thing but a little bit deeper, a little bit more pressure. Good. Tell me when you feel any pain or discomfort. And good. I do not feel anything outside the normal. Alrighty. Alrighty. I'm gonna come back here and check on your liver. Okay. Great. And then on your left, I'll check on your spleen. And I hear your gastric bubble right there. Okay. I will listen to your main vessels that run in your belly. And I'm going to use the bell. And check your renal. Good. Now I'll check your iliacs. Good. In this visit, we will skip the assessment of your genitourinary system, but we will go ahead and review a few things. Are you having trouble peeing or passing urine?
No.
No. Any burning or pain?
No.
Already. Any masses when you touch?
No.
Good. How about some lumps or tenderness?
No.
Good. So you want to make sure that you keep your appointment with your OB doctor. Okay. I have raised your head a little bit to 45 degrees angle, and I wanted to see if I will see any hernias or any masses there, and there is no change in your abdomen. Okay. So I do not think we have any. Okay. I will also look at your JVD, the jugular vein distension. I will have you turn that way. Okay. I do not see any on this side, then turn towards me. Good. It looks normal. Okay. Next, I'll feel for your carotid pulses, and then I'll listen for brewery. When I'm listening, I will have you inhale and hold. Okay. Okay. Good. So take a deep breath and hold. Good. And then take a deep breath and out. Good. Now take a deep breath and hold. Great. Sounds good. Miss Denise, I will come back here on your back, and I want to check if you can feel any tenderness over your kidneys.
Okay.
Okay. And this is called the costovertebral angus. Okay. So right here. How does that feel? Good. Any pain here?
No.
Already. Now that there is no tenderness or pain on your back, then that tells me that is a normal finding. Okay. Next, I'll inspect your arms.
Okay.
I'm gonna fold your gown up.
Okay.
And on the other side. And your skin looks good. I don't feel any sweat or clamminess. Let's see your pulses. And I'm getting a +2, which is the normal finding. Okay, those are your radials. I'll feel for your brachial. Great. Now show me your fingers. Good. I do not see any ridges or any fungal infection. I also don't see any spooning. Can I have you put your thumbs together and just show me that little angle? Good. That tells me that there is no clubbing.
Okay.
Good. Alrighty. Then let's check your capillary. Any numbness or tingling?
No.
Great. All right. Then next I'm gonna check your reflexes.
Okay.
I promise you I will not hurt you.
Okay.
Okay, so let's start up here. That's bicep. Okay. And then right here. Good. And then we will do your brachioradial. Great. And then on this side, your bicep. Good. And then your tricep. Great. And brachioradial. Great. That is good. Can I have you extend your arms already? And I want you to try and push against my resistance already. Here we go. Good. Now can you squeeze my fingers? Good. And I'll hold your arms up for 10 seconds. Great. So your capillary return is good. Your pulses are good. That tells me that the circulation is normal. There is no numbness or tingling. And your reflexes are positive.
Okay.
Good sign.
All right.
Miss Denise, next I will inspect your legs, okay? And I will remove the drip.
Okay.
So I'll check. Your skin looks good. I do not see any varicose veins. I don't feel any lesions or masses. Feel for your pulses. And another pulse right here. And then your popliteal pulses right there. Good. They are all +2, which is normal. Okay. Any numbness or tingling?
No.
Good. I do not see any redness, especially of your great toe. That is where the gout begins. That is good.
Good, yes.
Alrighty. And then I'll check your capillary refill. It is all less than 3 seconds, which is normal. Then I'm going to check your reflexes. Right below your patella, this is your patella reflex. Great. And then on the other side. Good. And then we'll check your Achilles. Just hold your leg. Great. And on the other side. And good. I'm going to look under your feet. Good. I do not see any lesions there. And I'll check for a reflex called Babinski. And that is good. Your toes are not flaring.
Okay.
And then on the other side, your feet looks good. And great. So all your reflexes are intact and your legs looks good. So now we're going to stand up and we'll check your strength. I'll remove the drape.
Okay.
Okay. And we already checked the strength in your arms, so we'll go straight to your legs, okay? I want you to bend your knee and bring it up. Good. All right. I want you to move your foot in and out. Good. Any pain?
No.
Okay, bend the other one. Good. And then your ankle. Good. Alrighty. Okay. So next I'm going to have you take a step forward and I'll come behind you. I'll have you close your eyes. I'll be checking your vestibular function, which is your balance. Okay? Ready? Good. That is it. Everything turned out good, Miss Denise. Thank you for coming in for your appointment today.
Thank you.
So during the physical examination, we skipped the breast and the genitals area because Miss Denise had recently had that done. If she had not had it done, I would have been looking at her breast for the symmetry, for the color, looking at the nipples so that they are not misaligned or there is no discharge coming from the nipples or any pain. And then I'll have her raise her arms and we'll check for any masses on both sides. We'll also go ahead and check for her axillary lumps. If it were a male, we would address their penis, any discharge coming from there, any swelling, any scrotal edema, any lymphadenectomy, and we would also talk about trouble initiating urination, which would most likely suggest trouble with their prostate gland. Thank you.